talk about how to take vital signs. Say you're in a home or in public and someone is hurt and you have to call 911. Knowing how to take someone's vital signs would be extremely helpful in saving their life and in speeding up the process to get them to the hospital. Vital signs include the measurement of temperature, respiratory rate, pulse, blood pressure, and sometimes blood oxygen saturation. These numbers provide critical information, hence the name vital, about a patient's state of health. In particular, vital signs can identify the existence of an acute medical problem. They are a means of rapidly quantifying the magnitude of an illness and how well the body is coping with stress. The more deranged the vitals are, the sicker a patient is. They are also a marker of chronic disease states, such as hypertension, which is high blood pressure. Okay. The materials needed to take vital signs include a thermometer, a blood pressure cuff, and today we're going to use an electronic blood pressure cuff, and also an oximeter. You will also need to have your eyes and your ears ready. The first step in taking someone's vital signs is taking their temperature. Normal body temperature is approximately 98.6 degrees Fahrenheit. Now I'll show you how to take someone's temperature. With this thermometer in particular, first you must pull it apart and put on a new casing for the thermometer so that you can dispose of this and it is clean for the next person to use. I'm going to come over to my assistant Sarah and I'm going to put the thermometer into her ear and press the big button that takes her temperature. It beeps when it's ready, and guess what? Her temperature is exactly 96.8 degrees, which is perfect. Now I'm going to throw away the tip to the thermometer. Part 2 of taking someone's vital signs is taking their respiratory rate. Respiratory rate is defined as the number of breaths a person will take per minute. A normal adult range is 12 to 18 breaths per minute. If I were to take Sarah's respiratory rate, I would not tell her that I was taking her respiratory rate. Otherwise, she would focus on her breathing and it would not be as natural as we would like it to be. All I would do is watch Sarah's chest or stomach, depending on the type of breather she is, go out and then in, and I would time this for a minute and count how many respiratory rates she has. The next step in taking someone's vital signs is taking their pulse. A normal resting pulse rate for adults is 60 to 100 beats per minute. The lower the heart rate, the better the heart is working. There are many ways to take pulse. You can take pulse manually by putting the middle of your finger on a vein, not the tip of the finger, because then you will feel your own pulse. I could take Sarah's pulse through her wrist or through her throat. But today, to simplify things, I will take Sarah's pulse using an oximeter, which I will explain in more detail later in the video. I simply put the oximeter on Sarah's finger and press the button to turn it on. This will tell me how many beats per minute her heart is putting out. Sarah's pulse is 95, which is excellent for a resting heart rate. The third step in taking someone's vital signs is to take their blood pressure. The definition of blood pressure is the pressure of the blood in the circulatory system, often measured for diagnosis since it is closely related to the force and rate of the heartbeat and the diameter and elasticity of the arterial walls. A normal range is when the top number, or the systolic, is below 120 and the bottom number, diastolic, is below 80. Today I have an electronic blood pressure cuff for time purposes only. You can also take blood pressure with a manual cuff and a stethoscope. If you're taking someone's blood pressure, it is best to have them sitting down with their legs not crossed. I will put this cuff on Sarah with the cord in the middle of the inside of her arm. It is important that you make sure the cuff is tight. And I will have her put her arm down, and I will keep the blood pressure machine on the table. I press start, and the machine does all the work. Let's see if Sarah has normal blood pressure. hurt to take your blood pressure, Sarah?
No.
It doesn't. It shouldn't. Sometimes it is tight at the beginning, but it loosens up as it's finding out what your pressure is. Sarah's blood pressure is 124/81, and again it tells me her pulse on this machine. If you'd like to see closer, good? Okay. Step 5 of taking someone's vital signs is finding their blood oxygen saturation, or their O2 level as we like to call it. Oxygen saturation measures the amount of oxygen carrying hemoglobin in the blood. Normal levels of oxygen are considered 95 to 100% oxygen. Anything below 92 is cause for worry. Back to the handy oximeter I used earlier to find Sarah's pulse. This is a machine that you simply put on the finger, press the button, and it will tell me the percentage of oxygen in Sarah's blood. You can pick these up at Walgreens for around $50, and they're really handy to have in the home if you're wondering if you should bring someone in for shortness of breath. Sarah's oxygen levels are 99%, which is wonderful. In conclusion, vital signs consist of, again, temperature, respiratory rate, pulse, blood pressure, oxygen saturation. I showed this to you so that in case of an emergency, you have an idea of how to help. Also, next time you or a family member is in the hospital or clinic, you will hopefully know what your own vital signs mean and if they are a sign of health or of sickness. Thank you, and I hope you learned a lot, and thank you, Sarah.